Welcome, everyone. Thank you for joining us for today's webinar, Exploring the Link Between Infection and Mental Illness, Results from Nationwide Studies, presented by Köhler-Forsberg, Aarhus University and Copenhagen University Hospitals, Denmark, Massachusetts General Hospital, and Harvard University. My name is Alexis Corrales, and I will be your moderator for today's event. We are delighted to bring you this educational web seminar presented by LabRoots. LabRoots is the leading scientific social networking website and producer of educational virtual events and webinars. Before we begin, I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want at any time you want during the presentation. Simply click on the Ask a Question box located on the far left of your screen and type your questions into the drop-down box. Our speaker will respond to your questions via email following the presentation. If you have trouble seeing or hearing the presentation, please click on the Ask a Question box to let us know that you're experiencing a problem. This presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located in the top right corner of the presentation window and follow the process to obtain your credits. Now, without further ado, please join me in welcoming Dr. Ole Köhler-Forsberg. I will now turn the presentation over to him.
Yes, hi everyone, and thank you for joining. Also, thank you for inviting me to give a speech at this conference. And as it was introduced, I'm going to talk about the link between infections and mental illness, and going to present some of our studies based on the Danish nationwide registers. So what I want to tell you about today is, first of all, I want to shortly introduce you kind of to the concept of Denmark as a country for register-based research and all the possibilities that we have in Denmark. And then, as I mentioned, present some of the studies we performed on infections and the subsequent risk for mental disorders. And then finally, I want to shortly discuss some of the potential mechanisms that may explain some of our findings. But before we come to that, I will just shortly present kind of the concept of the inflammatory hypothesis in mental disorders, so just that everyone is on the same page. So inflammation as a concept has been associated with many different diseases and disorders. Just to mention some are cancer, cardiovascular diseases, of course, but during the recent decades, more and more evidence has pointed towards that inflammation also is important in the etiology of mental disorders. And just to mention some examples from studies in schizophrenia, here's one meta-analysis from Michael Berg groups in Australia, where they found that C-reactive protein is increased in patients with schizophrenia compared to healthy controls. And C-reactive protein is, as you of course know, is one of the most important blood markers to measure the inflammatory load. And also some other studies where they investigated interleukin-6, which is one of the most important cytokines in the body, which also was found increased in patients with schizophrenia, and also the same for interleukin-1, which has also been found increased. So, and these were just some examples for schizophrenia. The results are quite similar for example, depression, bipolar, a lot of mental disorders. So there is quite robust evidence that inflammation, the immune system, is increased or associated with mental disorders. And some studies have also investigated whether this link between the immune system and mental illness could be due to genetic factors. And just to mention one short example, kind of a very well-known paper in Nature for a couple of years ago, where you see on this Manhattan plot, you see on the x-axis all the chromosomes, and the largest association in this genome-wide association study on schizophrenia was in the major histocompatibility complex gene, so which is one of the most important parts of the immune system. So also genetic links point towards an association between mental disorders, or in this case schizophrenia, and the immune system. But after this short introduction, I will now explain the concept of the Danish register-based research. So Denmark is a nice little beautiful country in the northern part of Europe, and there are approximately 5.5 million inhabitants. And what makes it so good and exclusive for register-based research is that there is this CPR number register. So every Danish citizen, either at birth or when you immigrate to Denmark, everybody receives a personal number or person number, and with that number, most of a lot of things are registered. For example, just to mention a few things which I will also use in this presentation, hospital contacts are registered. So, for example, in Denmark, all psychiatric hospital contacts have been registered since 1969, and all contacts to the somatic hospitals have been registered since 1977. So this is really a huge database with a lot of follow-up. And in addition, there is the prescription database. So since 1995, all prescriptions that were redeemed at Danish pharmacies, they have been registered. So as you can see, this is kind of a very broad and good setting. And in addition to these specific registers that I mentioned, there are a lot of other registers for education, whether one is in work, and so on. So that it's also possible to include important information on specific confounders for these studies. But this is kind of the overall setting for the Danish register-based studies. And now I'll first present, not so the studies on the actual infections and mental disorders. And I will first present a study from a good colleague of mine, Michael Benros, where they investigated the association between autoimmune diseases and severe infections as risk factors for schizophrenia. So they followed a total of 3.5 million Danes throughout 1977 until 2006. And there they had 39,000 cases of patients with schizophrenia. And this figure shows it quite nicely that you see on the x-axis, there are shown the amount of hospital contacts with infections. So in this study, they only had access to hospital contacts, so it's only the severe infections. But as you can see, the risk for schizophrenia increases depending on the amount of hospital contacts with severe infections. And further, this figure also shows the difference between the red and the blue bars, that those who in addition also had an autoimmune disease, that's just any kind of autoimmune disease, those were associated with an even higher risk for developing schizophrenia. So this kind of a nice and clear dose-response relationship between the amount of severe infections and a higher risk for schizophrenia. Furthermore, they also looked into the specific types of infections. And this is from a slightly different study, but still the same data, and where they found that hospital contacts for infections in general increased the risk for schizophrenia, but then when they looked on the specific agent that caused the infection, they found that bacterial infections increased the risk the most, and even more than viral infections or other type of infections. Okay, and these are very interesting, a good study, but kind of the major limitation was that in this study they only included the severe infections. So they only had information on hospital contacts with infections, which of course are the most severe, whereas the majority of infections in the population are of course not causing a hospitalization, but they are treated by the general practitioner. So to approach these limitations, we wanted to perform some studies where we included information on the less severe infections. And those are some of the studies that I want to present to you now. And what we did is that we, as I mentioned earlier, in Denmark, there's this prescription registry with all redeemed prescriptions since 1995. So we had information on all the redeemed prescriptions for all anti-infective agents since 1995. And that included antibiotics, antivirals, antimycotics, and antiparasitic agents. And again, this is outpatient treatment. So when a patient, for example, went to the general practitioner, and the general practitioner made a prescription for an anti-infective agent, and the patient redeemed it. So we have no information on treatment during hospital stays. And the first study that I would like to present you is a study on childhood and adolescence mental disorders. So it was recently published, and here we investigated the association between the treated infections and the subsequent risk of mental disorders in children and adolescents. And as you can see here, it's just shortly shown from the abstract. We included all individuals born between 1995 and 2012, which yielded a study population of almost 1.1 million individuals. And as I shortly mentioned, the exposure was that we could include all the treated infections. So we included both information on the severe infections that required a hospital contact, which also was the main exposure in the study, which I've shown before. But here we also had the information on the less severe infections that were treated with the anti-infective agents in a primary care setting. All right. And the results showed that first, if I present the findings on the severe infections, so the hospital contacts with infections, here we found that individuals who had been hospitalized with an infections compared to individuals without hospital contacts, they were associated with an 84% increased risk for any mental disorder diagnosis. So this means a risk for being diagnosed with a mental disorder in a hospital, but it was also associated with an increased risk for just any psychotropic medication use. So when individuals redeemed a prescription for antidepressants or antipsychotics or ADHD medication. So this was the severe infections, the hospitalizations. And when we then included this additional information on the less severe infections that were treated with anti-infective agents, we found that these less severe infections were associated with a 40% increased risk for being diagnosed with a mental disorder in a hospital-based setting, and a 22% increase for redeeming psychotropic medication. So also this kind of quite nicely shows that infections in general, the severe infections, but also the less severe infections, are associated with an increased risk for mental disorders. And these analyses were associated for several important confounders, such as mental disorders in the parents or the educational level of the parents. Next, I would like to show you these figures where this figure is showing the risk for being diagnosed with a mental disorder in a hospital setting. And on the x-axis, you have the amount of anti-infective agents. So all the different times that these individuals redeemed a prescription for anti-infective agents. And you can see, again, that the risk increases in a dose-response relationship, and that the risk was higher among those who also had been hospitalized for an infection, which is the light blue bars. And we found the same dose-response association for the risk for prescriptions for psychotropic medication. So showing that the risk for both mental disorder in a hospital setting, but also psychotropic medication increased depending on the amount of infections and also the severity, since it was higher among those who were also hospitalized with an infection. Okay, and now I will show a bit, this is a bit busy table, but this is just to give you an overview of what we did in this study. So the results that I presented until now were on just mental disorders in general. But then we also looked on the specific disorders that were diagnosed in the hospital-based setting. And when we looked on the specific disorder or the specific mental disorder categories, we found that the highest risks were associated with schizophrenia-spectrum disorders, anxiety disorders, specifically OCD. There were also for personality and behavior disorders, mental retardation, which I know is now called cognitive impairment, but in the ICD-WHO system, it's called mental retardation. And we also found increased risk for the entire spectrum of behavioral and emotional disorders. So this more dissected view on the specific disorders highlights some specifics, some specific disorder categories that were more increased than others. Okay, so this was a study on the infections and then childhood and adolescence mental disorders. And as a next study, I want to show you a study where we investigated specifically on affective and schizophrenia spectrum disorders. And this study, which was published a couple of years ago, and here we included approximately 1 million Danes that were born between 1985 and 2002. And we had follow-up until 2013. So you can see that this is early onset of affective and the schizophrenia spectrum disorders. But as in the previous study, we had information on redeemed prescriptions for anti-infective agents and also on hospital contacts for infections. So it's a bit the same setup and the same exposures, but just that we had a bit older study population and longer follow-up. Okay, and what we found is that when we investigated the risk for the less severe infections that were treated with anti-infective agents, we found an increased risk of 64% for being diagnosed with an affective disorder, and we also found a 37% increased risk for being diagnosed with a schizophrenia spectrum disorder. And these risks were even higher among those individuals who also had been hospitalized with an infection. So the risk also increased depending on the severity of the infection. And furthermore, as you can see in this figure, we also found a dose-response relationship. So again, on the x-axis, you can see the amount of anti-infective agents that were redeemed. And you can see that the blue bars are the risks for affective disorders, whereas the red bars are the risk for schizophrenia spectrum disorders. And for both outcomes, we found a dose-response relationship, which was a bit more pronounced for the affective disorders. As a next step, we then looked on the specific anti-infective agents, as you can see here. So specifically the antibiotics, antivirals, antimycotics, and antiparasitics. And for the antibiotics, we divided the antibiotics depending on the broad spectrum or narrow spectrum of these drugs. And these numbers shown here are the risk for developing a schizophrenia spectrum disorder. And as you can see, the risks were higher for antibiotics, and we found no significant findings for antivirals, antimycotics, and antiparasitics. Furthermore, the interesting part is that the risk was higher depending on the more broad spectrum of the antibiotics. So the broad spectrum antibiotics were associated with the highest risks, whereas the narrow spectrum were associated with a bit lower risk. And we found the same associations regarding the risk for affective disorders. Again, antibiotics, and specifically the broad spectrum antibiotics, were associated with the highest risks for affective disorders. So then overall, we found that that infections or the treatment with it, kind of the antibiotics, were associated with an increased risk of these severe mental disorders. And we both found that for childhood adolescence mental disorders and the severe mental disorders, affective schizophrenia spectrum disorders. And these findings can be explained by several factors. So first of all, the infection itself can, of course, even if it's a peripheral infection, these infections are known that they also can affect the brain and the central nervous system. So the first possibility is that the infection itself can affect the brain and hence lead to this increased risk for mental disorders. Another possible explanation is, and as I also wrote, whether the infections or the antibiotics, another possible explanation is that the treatment itself can affect the gut microbiome and through that way affect the brain. So a lot of research during the recent years has pointed towards the importance of the gut microbiome and brain axis. And it is known that antibiotics specifically affect the microbiome. And since there are many routes of communication between the gut, the microbiome, and the brain, this is one possibility. Although this is still a lot of research has to be performed in this area to further understand this potential link. And next explanation is, as I also shortly mentioned in the introduction, is genetics. So our findings could be explained by that these individuals are just at a kind of genetically higher risk for acquiring infections and being diagnosed with a mental disorder. So since there have been findings between genes coding for the immune system and the mental disorders, this could be explained by genetic factors. But in addition to these three potential mechanisms, one additional and very important explanation is due to the nature of our studies. So our studies are of observational nature, and hence it is very important to think of the socioeconomic status. So the socioeconomic status could explain several of our findings, and which basically means that kind of the lower socioeconomic status, then the less education, the less hygiene, and lower socioeconomic status is also associated with a higher risk for mental disorders, and that this lower socioeconomic status also could lead to more infections. So the associations we have found could be explained by the socioeconomic status aspects. But overall, a lot of possible explanations, but in general, some interesting findings linking infections and immune system with mental disorders. And with this, I would like to thank you very much for your attention. Thank you.
Thank you, Dr. Köhler-Forsberg, for that informative presentation. I would also like to thank LabRoots for making today's educational webcast possible. Before we go, I want to let everyone know that this webcast will be available for on-demand viewing through June of 2019. As a final reminder, our speaker will follow up with any questions you submitted via email. That's all for now. Thank you for joining us, and we will see you next time. Goodbye.